Morning Britain coming up on the show. An 11% pay rise. Will it be enough to stop junior doctors going on strike?
Even if Jeremy Hunt offered a 100% pay rise, doctors will not accept it because this contract remains unsafe for patients.
Our top story this morning, and the Health Secretary Jeremy Hunt is to offer junior doctors an 11% pay rise as part of a package of concessions to stop them voting for strike action over Christmas. It follows a series of protests against planned contract changes in England. A ballot on industrial action opens tomorrow. If junior doctors vote in favour, routine operations and clinics could be cancelled.
Jeremy Hunt has made an offer of a supposed pay rise of 11%. Which in actuality would be a real times pay cut. But the main issue is that he has not made any guarantees on safety at all.
So our main news at 7 o'clock is that the Health Secretary Jeremy Hunt is to offer junior doctors an 11% pay rise as part of a package of measures to try to stop them voting for strike action over Christmas.
Well, of course, it follows a series of protests by doctors against planned contract changes in England. In fact, a ballot on industrial action opens tomorrow. And Katie Rickett is at Leeds General Infirmary. So, Katie, ministers seemingly keen to avoid strikes this winter.
Well, yes, of course, it's the time of the year when hospitals like this are the most stretched, and a strike would mean clinics and operations cancelled, putting further pressure on over the festive period. And so Jeremy Hunt has announced this raft of concessions, assuring us on Good Morning Britain that it means a better deal for patients, a better deal for doctors. The question is it enough to convince them with just hours to go and avert a crisis this Christmas? After weeks of protests, a promise over pay and working hours from the Health Secretary. Junior doctors say their new contracts involve pay cuts and dangerously long hours. Today, Jeremy Hunt's putting a new offer on the table. It'll include an 11% increase in basic pay, a better pay offer for working antisocial hours, and a working week capped at 72 hours.
Independent voices are saying that these will improve patient safety. It's a good deal for doctors. It's a good deal for doctors who work part-time because they'll see their basic pay go up. And it's a good thing for patients.
But junior doctors still aren't happy.
Essentially, this pay rise is not a pay rise at all. Even if there was a pay rise on offer, junior doctors would not accept it because there are no safeguards on how long your doctor works. And that affects patient safety.
More than 350 consultants have written an open letter saying these proposals could spark a staffing crisis. With the British Medical Association to ballot 40,000 members this week, this offer could be Jeremy Hunt's last chance to avoid strike action. Katie Rickett, Good Morning Britain.
Good Morning Britain coming up on the show this morning. An 11% pay rise. Will that be enough to stop junior doctors going on strike?
Even if Jeremy Hunt offered a 100% pay rise, doctors will not accept it because this contract remains unsafe for patients.